Every expectant mother wants a healthy baby, but many clinics in sub-Saharan Africa lack the basics. Basics that doctors and nurses need to ensure safe deliveries for parent and child. Basics like reliable electricity. These clinic workers in Kano, Nigeria, describe what it's like to treat patients in the dark.
It's not easy for taking delivery, taking baby without light. We have to look for a lamp or any other thing. The patient can be bleeding. Anything can happen to her, and there is no way, no light, nothing to see what is going on, what is happening to the patient.
American obstetrician Laura Stachel was appalled by the lack of light when she first visited Africa in 2008.
In the middle of the night, very often there was no light whatsoever, and they were using kerosene lanterns to try and examine patients with severe medical conditions. I was watching a C-section where the lights went out, and the doctors had to finish by my own flashlight. That was the only lighting available.
Dr. Stachel turned to her husband to help her come up with a solution.
My husband is a solar educator and an innovator, and he said, Laura, when you come back, maybe we can think of something to at least help the electricity situation in the hospital. So together, when I got back from Nigeria, we thought about what could we do to make a difference in this one hospital. And we thought, well, we could use solar electricity because the sun is a free source of fuel.
They began with large solar panels put together in their backyard. Today, suitcase-sized kits provide the power of light to almost 200 clinics around the world.
I asked my husband if he could put together a kit that was small enough for me to fit into my suitcase so I could slip through customs easily. And I also didn't know a lot about solar, so I said, could you make this easy enough for me to use so that put together everything you can so that I can just put together a couple of wires at the end and show them what to do. You will have a way to charge headlamps.
On a recent training trip to Nigeria, Stachel's suitcase of reliable power was well received.
We'll be very happy, and everything will go on smoothly, and now we will try more and more.
Despite this success, Dr. Stachel says adequate lighting and reliable electricity are only the beginning of the story. Beyond that, she says, it's important to make sure that health workers also have the right education, tools, and support to do their jobs. For VOA's Africa Health Network, this is Linda Ringe.